have prior medical records within the HPI as well. So that stuff is definitely important, and we'll revisit it at the very end of today. But now we're moving into our objective territory. So, objective is factual. In particular, we think about things that happen during the ED visit. So, let's say a nurse notes in triage that the patient had a high blood pressure. That would be treated as objective. If the doctor sees something in the room, that's part of the objective exam. And if we get a lab result back during the visit, that would also be objective. So just try to keep those rules in mind because many times people will start to confuse the ROS and the physical exam, but we don't want to fall into that trap. So it's important to distinguish subjective and objective details. So today we're going to focus on the physical exam. Course 5 will fill in the gaps when it comes to labs and imaging. So what is the physical exam? Well, basically, this is really old school medicine. Before we had all this fancy high tech equipment and labs, doctors were using the exam for millennia, excuse me, to figure out what was going on with their patients. So if you're a history buff, it can be pretty interesting to look into this stuff. But just know that a typical routine exam has three main components. First is inspection. Inspection is basically the stuff we observe on a patient. So let's say I walk in the room and I see a rash covering the patient's body. That's something I'm getting through inspection. Palpation more so involves the act of pressing. So I walk over to the patient and I start poking their abdomen. If they wince, I would say they're tender to palpation. And then auscultation is what we see in this picture. So when the doctor pulls out their stethoscope, they're using it to listen to part of the body. In this case, since it's the patient's chest, likely they're listening to the heart sounds. So while some doctors will have some variations, in general, an average exam has all of these components. So the reason why physicians are still trained in this nowadays is that while we have a lot of high tech equipment, the physical exam is really good to help us narrow down or potentially rule out certain concerns or diseases. For example, if the guy in this photo had chest pain, there could be dozens of things going across my mind about why his chest hurts. If I do the exam and let's say I palpate the chest wall and he's tender here, that may tell me that there's something going on with the muscle in that spot and not necessarily something like a heart attack. Because for one, the heart is actually on the other side of the chest. And two, usually muscle issues are reproducible with palpation. So, as a future doctor, when I have a patient like this, I might decide to give them a muscle relaxer first to see if that helps before I try to schedule them for like an echocardiogram or anything extensive. So, the exam helps us to be very conservative on what we do and consider. Now, the role of a scribe is not to be an expert as far as every minute exam finding. I promise you here now, we are not going to ask you to show up to floor training to demonstrate operator assigned to your chief scribe. But the thing you want to start thinking about now that we're going to continue to work on in floor training is you have to be able to watch what's going on in the room and have a general understanding of what the doctor is investigating. So, for example, what do you think the doctor is investigating in this photo? They're feeling the patient's wrist while also looking at their heart or their watch. Exactly. So it looks like he's feeling the pulse and he's checking the heart rate, the number of beats per minute. Now, as scribes, we're not mind readers. So it's not like I can give you a photo and you know exactly what the doctor's thoughts are. But the fact that you're picking up on these details is important because that's going to mentally prime you to be ready to document the information later. Yes, the doctor may say something in the room, but many times they're going to wait until they leave to mention findings. And so if I need to get the doctor's attention, and they start giving me the exam, I'm already anticipating that they'll say something about the heart. So again, I'm kind of ready to document that information. I know exactly where to go in the notes. So again, the closer you pay attention, the easier it'll be with picking up the findings that they give you. But speaking of documentation, out of curiosity, does anyone here